Picture this. It's late at night, and a sudden health worry pops into your mind. Maybe it's a strange ache, a rash, or a question you're too embarrassed to ask anyone else. Instead of waiting until morning or stressing about booking a doctor's appointment, more and more people are turning to AI chatbots like ChatGPT for instant answers and advice. These digital companions are available 24/7, ready to respond when anxiety strikes, no matter the hour. The traditional healthcare system often means long waits, crowded waiting rooms, and the frustration of delayed appointments. For many, the idea of waiting days or even weeks to see a doctor just isn't practical, especially when you want answers now. This shift isn't just a passing trend. Recent polls reveal that a growing number of adults are now using digital tools and AI chatbots to seek out health information. In fact, surveys show that people of all ages, from tech-savvy teens to older adults, are embracing these platforms as a first step when health questions arise. What makes AI chatbots so appealing? For starters, they offer instant, judgment-free responses. There's no need to feel embarrassed or rushed, and you can ask as many questions as you like. The convenience and privacy of chatting with an AI, especially from the comfort of your own home, is hard to beat. When anxiety is high and you're searching for quick reassurance or guidance, these tools can feel like a lifeline. They provide immediate feedback, which can help calm nerves or point you in the right direction, at least temporarily. Today's AI models are more advanced than ever before. Some have even passed medical licensing exams and demonstrated the ability to solve complex cases in research settings. Their knowledge base is vast, drawing from countless medical journals, studies, and real-world cases. Because of this, many people now see AI chatbots as more than just search engines. They're viewed as sources of real medical insight, tools that can help interpret symptoms, explain test results, or suggest next steps. But this growing reliance comes with real risks. While instant answers can empower us, they can also mislead. AI chatbots aren't perfect. They can make mistakes, misunderstand symptoms, or provide information that increases anxiety rather than easing it. In some cases, acting on incorrect advice could even cause harm. As we step into this new digital health frontier, it's more important than ever to understand both the potential and the pitfalls. Embracing technology can make healthcare more accessible, but it also means we need to be cautious and informed users. Remember, AI can be a helpful assistant, offering support and information, but it's not a replacement for a real doctor's expertise, experience, or personal touch. When it comes to serious or persistent health concerns, consulting a healthcare professional is always the safest choice. The key is knowing what AI can and cannot do. By understanding its strengths and limitations, we can use these tools wisely, empowering ourselves with information, while still relying on human experts when it matters most. Used correctly, AI chatbots can be powerful allies in your healthcare journey. They excel at translating complex medical jargon into plain language, making diagnoses and treatments easier to understand. Before appointments, you can ask AI to help you prepare questions or clarify your doctor's advice, turning you into a more engaged patient. Chatbots can also provide practical tips, like meal plans or medication explanations, to help you follow your treatment plan. While they lack true empathy, their calm, factual information can ease anxiety and fill the gaps between medical visits. Think of AI as a 24/7 resource for education and preparation, not as a substitute for professional care. Despite their impressive abilities, AI chatbots are far from perfect. While they can process vast amounts of information in seconds, they can also make serious mistakes, sometimes inventing facts or misinterpreting symptoms in ways that a trained human would not. These errors can be subtle or glaring, but either way, they can have real consequences for your health. AI might give outdated, biased, or simply wrong advice, especially if it's drawing from old data or unreliable sources. Sometimes it can even sound convincing while being completely incorrect, which makes it even more dangerous for people who aren't medical experts. This hallucination problem means chatbots might confidently present false information, making it hard for non-experts to spot mistakes. The chatbot doesn't know when it's wrong, and it won't warn you if its answer is based on guesswork or incomplete knowledge. Even subtle inaccuracies, like using old guidelines or missing recent medical breakthroughs, can lead to poor decisions about your health. Medical knowledge changes quickly, and AI can lag behind. AI also struggles with cultural context, language nuances, and personal factors that a real doctor would consider. This can result in advice that doesn't fit your background, beliefs, or unique health needs. Unlike doctors, AI lacks human judgment and empathy. It can't interpret nonverbal cues, sense urgency in your voice, or notice when you're distressed. These are critical skills in healthcare that no algorithm can replicate. Never use AI for direct diagnosis or urgent medical advice. It can easily miss emergencies, delay critical care, or cause unnecessary panic by misreading your symptoms. There have already been real-world cases where AI gave harmful or even dangerous medical advice, leading to confusion, anxiety, or worse. Your health is too important to trust to an algorithm that can't be held accountable for its mistakes. If something goes wrong, there's no one to answer for it. For anything serious, urgent, or unclear, always reach out to a qualified healthcare professional who can listen, ask questions, and provide care tailored to you. Use AI as a tool for general information or to help you prepare questions for your doctor, but never for life or death decisions or to replace real medical advice. Remember, only a human doctor can provide safe, personalized care, understand your unique situation, and guide you through complex health decisions with compassion and expertise. Medicine is more than science. It's about human connection. When you walk into a doctor's office, you're not just seeking a diagnosis or a prescription. You're looking for someone who understands your worries, who can read your body language, and who genuinely cares about your well-being. Doctors offer empathy, listen to your fears, and provide comfort that AI simply can't replicate. The warmth of a reassuring hand, a gentle smile, or a few kind words can make all the difference when you're feeling vulnerable or scared. Physicians use observation, intuition, and years of experience to make nuanced decisions, integrating what they see and hear with your medical history. They notice subtle changes in your mood, your posture, or even the way you describe your symptoms, details that algorithms can't pick up. AI only knows what you type. It misses nonverbal cues and the bigger picture. It can't sense hesitation in your voice or the worry in your eyes. It doesn't know your story, your family, or the context of your life. Managing chronic or complex conditions requires ongoing, personalized care, a dynamic partnership built on trust. Over time, your doctor learns your unique needs, your preferences, and your health journey, adjusting care as your life changes. AI can't remember past conversations or adapt to your evolving needs. It doesn't follow up to see how you're feeling after a tough diagnosis or celebrate your progress after months of hard work. Doctors are accountable for their advice. AI operates in a legal gray area with no responsibility for mistakes. When a doctor makes a decision, they stand by it, and you know who to turn to with questions or concerns. The human touch, empathy, judgment, and responsibility is irreplaceable in healthcare. It's what transforms treatment into healing and information into understanding. Use AI as a supplement, not a substitute. Technology can help you learn and prepare, but it can't replace the wisdom and compassion of a real healthcare provider. Trust in the art and accountability of real medicine. Your doctor's expertise, intuition, and care are the foundation of your health. Your well-being deserves nothing less than the human touch, because healing is about more than just answers. It's about connection, trust, and care. If you're curious about using AI for health, start with low-stakes questions. Ask about common conditions or medical terms you already know. Compare the chatbot's answers to advice from your doctor to spot strengths and weaknesses. Use AI for practical support, like meal plans or exercise tips, not for diagnosis. Always treat AI responses as a starting point, not the final word. Maintain skepticism and double-check information elsewhere. The more you practice with safe topics, the better you'll understand both the tool and your own ability to evaluate digital health info. Remember, AI is a tool. Its value depends on how you use it. Stay cautious, and you'll become a smarter, more empowered patient. The quality of your AI answer depends on how you ask. Avoid leading questions that reinforce your own biases. Instead, ask open-ended, neutral questions for broader, more accurate responses. Give enough context, like age or general health status, but never share personal details. Keep your questions general to protect your privacy. Use AI to summarize and explain, not to make decisions for you. Let the chatbot educate, but leave the judgment to you and your doctor. Sharing health info with AI chatbots isn't private. Unlike your doctor's office, these platforms aren't bound by strict privacy laws. Your questions may be used to train the AI or viewed by developers. Never share names, addresses, or any details that could identify you. Treat every AI chat as if it's public. If you wouldn't post it online, don't type it in. Use personal devices on secure networks to reduce digital risks. Frame questions hypothetically, not personally, to keep your health status private. Protecting your privacy means keeping queries general and anonymous. Use AI for general knowledge, not as a personal confidant. Stay vigilant to keep your sensitive information safe. After using AI for health info, always verify everything with a real healthcare professional. Treat chatbot answers as research, not medical advice. Your doctor knows your history and can interpret information in context, something AI can't do. Bring your AI research to appointments to start productive conversations. Let your doctor confirm, correct, or clarify what you've learned. The goal is to be an informed patient, not your own doctor. AI is a helpful ally, but only humans can provide true care. Trust your doctor's training and experience above any algorithm. When it comes to your health, human expertise is irreplaceable. AI is here to stay, transforming healthcare by analyzing data and supporting doctors, not replacing them. In the future, AI will handle routine tasks, freeing doctors to focus on empathy and complex decisions. For patients, AI will be an educator and guide, helping you prepare for visits and understand your health. But the line between information and medical advice must remain clear. Dr. ChatGPT is a myth. AI is a partner, not a physician. Use it to learn and prepare, but trust your care to real doctors. True healthcare is deeply human, requiring wisdom and empathy no algorithm can match. Let AI empower you, but always rely on the human touch for your health.